Thank you for joining me for this demonstration of the Replan COVID-19 planning tool. So the first thing I'm going to do is I'm going to create a new scenario. So I'll give it a name. Then I first select a state. Then I select whether I want to plan for on the county level, for places, which are cities or city-like entities, or state service regions, or if I have a custom region that I either want to create or I want to plan for one that's already been created. For now, I'm just going to use counties. I'm going to select Fulton and DeKalb. That's basically the two counties that make up the area for the Atlanta metropolitan area. Okay, so now that the scenario has been created, I can see I've got the Fulton, DeKalb counties here. And go up and I see at the top I've got the map, or I've got a facilities tab where I can see different types of facilities that are already preloaded into Replan. So hospitals, places of worship, high schools, pharmacies, police stations, stadiums, so on and so forth. Let's go back to the map. Over here, I see I've got these facilities that I saw in this tab. I can also turn them on and off so I can see where they are on the map. Now here, let's open up the main menu, and I'm going to start with the info panel. So the info panel tells me what the total population of this area is that I'm looking at, and what the total uninsured population is. Now the reason uninsured population is important, specifically in the context of COVID-19, is that when the vaccines are being mass produced, such that we are going to start mass vaccination campaigns, well, many individuals are going to be able to simply get their vaccines from their primary care providers. However, not everyone has a primary care provider. Therefore, we need to be able to account for those individuals that do not have a primary care provider. Well, the ones that don't have a primary care provider probably are the same ones that don't have health insurance. Therefore, we're using the uninsured population as a proxy for the population that does not have a primary care provider. Now, the reason this is important is because those that can't receive the vaccination from a primary care provider will become the responsibility of whatever state, regional, or local health department is serving them. And that's really who Replan is developed for, these health departments. So we can see there's 220,000 individuals here that are uninsured. Now you'll notice as I zoom in, these numbers change. The reason these numbers are changing, even as I pan around, is because these numbers represent only the area that I'm looking at right now on the map. Now the reason we've implemented this system to have this feature is because we want Replan to be accessible to public health practitioners that don't necessarily have any GIS expertise. Yet at the same time, we want to be able to enable these practitioners to drill down into the data that's available to understand how their population changes, how demographics change across the jurisdictions. So now the next thing we're going to do is we're going to go into the resource analyzer. So here in the resource analyzer, you'll see I have a total population or an uninsured population option. Now, total population is what I want to consider if I'm looking at testing, because the public health department may be responsible for creating testing resources or testing pods for the entire population. Whereas for vaccination, as I mentioned before, you would really be looking simply at the uninsured population. So since we're talking about vaccination in this particular video, I'll select that. Now there's 3 sliders here. The first slider asks, how long does it take per individual at a dispensing lane, or a vaccination lane in this case? And this time is in seconds. So I've got it defaulted at 3 minutes, 180 seconds. Let's move it up. Let's put it maybe at 5 minutes. So here I'll actually just type it in. So it'd be 300 seconds. The next is the number of vaccination lanes you would expect to have per pod. Of course, not all pods are going to be the same. Some will have more lanes and some will have fewer. But this is just on average. What do you expect to see? What we're doing here is we're trying to determine how many pods we'll actually need to serve this region. So in the case of something like anthrax, where we're handing out pill bottles, we could potentially have more lanes. Now, since we're doing vaccination, and since timelines are going to be much longer for COVID vaccination campaigns than they would be for mass dispensing for anthrax, let's put this down to maybe 4 or 5 lanes. Let's go down to 5. All right. The next question it asks is, what is the total number of lanes? Now that's the total number of lanes across this entire 2-county jurisdiction. Now the way we decide this is we drag this slider up until the plan execution time becomes reasonable to us. Now for our plan execution time, I'm going to assume that we want to do this in 240 hours, which is, I'm coming up with that number because I'm basically thinking, well, if a vaccination pod is running for 4 hours per day, 5 days per week, for 12 weeks, that would be 240 total hours of plan execution. So let's move this until we end up somewhere around 240. There we go, that's pretty close. So this says we need 16 vaccination pods across this 2-county region. Next thing I'm going to do is I'm going to go into our equal population partitioning tool. What this is going to do is it's going to divide these 2 counties into 16 partitions. Each one of these partitions is going to have almost an equal number of uninsured individuals. And here it's done. So I'm going to go now, I've got another tab, the Pod Manager tab. Now look at my uninsured population distribution, and you see all the bars, all 16 of them are almost equal. They can't be exactly equal because here I'm lumping together entire blocks of individuals at a time. These blocks are basically population blocks that I get from the Census Bureau. In this case, it's either block groups or census tracts, depending on the particular data set we're looking at. Now, let's take a look at the pod times. So this red bar basically shows my deadline that I indicated in the slider tool for the resource analyzer. We could see that all of these pods could either, almost all the pods can either meet or beat this time, with the exception of just a very few, just barely exceed it. So this looks pretty good. One problem that we have though is that down at the bottom, you'll notice all these pods just have names like Uniform Pod 1, Uniform Pod 2, so on and so forth. Well, let's find out where Uniform Pod 1 is. I can click on it and Replan will zoom into it. So here it looks like it's not far from Joel's Lake, but I'm not really familiar with this area. So I'm going to go back to the Pod Manager. Rather than clicking on the name, I'm going to click on this icon, which deep links directly into Google Earth. So here we'll be able to see, okay, we're basically at a hill near the end of a cul-de-sac. Probably not the best place for a vaccination pod. So we need to move this pod location and probably all the other pod locations to actual facilities that can host them. Now the way these pod locations have been selected was basically that we partitioned this 2-county region into areas of uniform uninsured population. And then we simply suggested a pod location at the geometric center of each one of these areas. So now we actually need to place the pods somewhere that makes sense. I have a lot of different candidate facility types that are already loaded into Replan. So here you can see them. All I need to do is drag whichever ones of these up here into the priority list. And I put them in order from the highest priority to the lowest priority. In other words, let's say I want to choose stadiums, and if there's no stadium nearby, I'll fall back to maybe a pharmacy and then a place of worship. So I'll click Auto Place, only take a moment. And now you may have noticed on the map, these moved ever so slightly. I go back to the pod manager and now I'll see I actually have names for each one of these locations. And I can expand these and see actual addresses and everything. Now my problem is that since the suggested pod locations were in the geometric centroid of each one of these partitions, but now I've moved these pods outside of the centroid, then these partitions don't necessarily make a whole lot of sense anymore in terms of being able to predict where individuals are likely to go to get their vaccinations. For instance, if we look at these pods down here, this pod location was suggested to be around here, but the closest facility it found was over here. What's to keep someone that lives here from just crossing this imaginary boundary line to go here? Or someone that lives here from crossing this imaginary boundary line to go there? Well, nothing. What we need to do is we need to put these back in the centers of our partitions so they actually become catchment areas. Now, of course, we can't move the facilities themselves, so we have to redraw the catchment area boundaries. However, the catchment area boundaries are what gave us this very clean, uniform distribution. Nonetheless, if you think about it, what we've done by selecting pods according to this distribution of uninsured population is we basically put more pods where there are more uninsured individuals and fewer pods where there are fewer uninsured individuals. So what we've already achieved here is that we've placed our pods according to where the population demand already occurs. So if we have to change the partitions a little bit and we lose that uniformity, it's okay, because what we've already gained is the ability to quickly select pod locations, which we've done. So now I'm going to do what we call the closest pod partitioning, where I'm going to assign each census block group to the closest pod. And you notice these boundary lines shifted a little bit. When I go back into my pod manager, I'll see my household distribution's not horrible, or not household, my uninsured population distribution's not horrible, but it's not as uniform as it was before. Now, what effect is that going to have on pod times? Well, now that red bar stays in the same place, but we have more pods that exceed it, and the pods that beat that time beat it by a significant amount more. So why is it that this pod takes more time and this one takes less? Well, obviously it's because this pod has a larger population and this one has a smaller one. Now the way to rectify this issue is to observe that, well, at the beginning, remember, I asked in the slider tool how many dispensing lanes or vaccination lanes would we expect to see on average in each pod. And I chose 5. Therefore, the system has given every pod the same number of vaccination lanes. But in reality, this pod doesn't necessarily need 5, but this one needs more. The system, by clicking the Resolve Deficit button, can calculate the minimum number of lanes required by each pod to meet or beat this timeline. So now we can see they all are within underneath this red bar. So here's the number of lanes I can sort. I could see the smallest pod now only has 4 lanes. The largest one has 7. If for some reason I think that a pod can't handle this many lanes, then I can manually create pods, manually move pods, so on and so forth, to fine-tune this plan. So now that we actually have a response plan, the beginnings of a response plan, keep in mind that all we've done at this point is really look at just total population and total uninsured population. But we haven't looked at other demographic variables that could indicate population vulnerabilities. So we need to do a vulnerability analysis. This takes just a moment to process. Here we go. So the first one I want to show you is language. If an individual does not speak English but speaks some other language, that individual is going to have trouble participating in the response. They're going to have trouble potentially following instructions, being able to get to the pod to receive their vaccination, understanding what they're supposed to do to be able to participate in the response activities. Therefore, it's imperative that planners be able to allocate resources, whether it be documents and paperwork, signage, translation resources, whatever it needs to be able to serve these individuals. So let's start looking now at the Chinese population. This is the population of Chinese speakers that don't speak English or don't speak English well. Now, we show this in two different ways on the map. The first way is basically showing these little polygons, which are all census tracts. We color code them according to the total count, the total number of people in each tract that don't speak English or don't speak English well, but do speak Chinese. So here we could see there's more here, here, in this area, and over here. However, as a planner building a vaccination pod scenario, what you really need to know is how this maps to the individual pod locations you have planned. That's where these point locations come in. So you'll notice our pod markers have changed to something that looks like a thermometer, where if the thermometer is completely green, that means there's a fairly low number of this type of vulnerable population that would be expected to visit this pod. However, as the thermometer gets more and more red, we have more and more of this type of vulnerable population that would be expected to visit this pod. Now, I ask you, if you only had two Chinese speakers that you could place at all of these pods across this 2-county region, where would you put them? Well, obviously, you'd put at least one here, and you may put another one there. We can do this for other languages as well. Let's look at Korean or Vietnamese. So Vietnamese, the hotspots are really down here instead of up here. Do Arabic. So Arabic, we have things spread out more around here as well as there. So with this, we get to drill down to individual language types. So it's not just looking at people that don't speak English or don't speak English well and where they are, because that doesn't help you understand what resources are truly needed from one pod to the next. We have to look at what specific resources are needed by the population per pod to be able to truly handle these vulnerable, at-risk, and special populations. Now, of course, there's ways to look at this other than the map. We can go to the language tab. For each one of these languages, we're also developing a bar chart. Or down below, we have it in a tabular format, where we have the pod, the IDs that the pre-planned system has defined for each pod, along with their names, and then columns for each one of these different languages. And in those columns are the number of individuals that we've mapped to each pod location. Of course, there's an export button where you can export all this as a CSV file that can be easily opened up in a spreadsheet program like Microsoft Excel, a database application like Microsoft Access, or a GIS application like ArcMap. Next, let's take a look at age. So if you want to know where the elderly population is, so 65 years plus, we can look at a map for that, or the pediatric population, or minors. Just like we had for language, we have bar charts for each one of these different subgroups, as well as a table that can be exported so you can use it externally to replan. Now, disability status. We have hearing disability, vision disability, ambulatory, so on and so forth, with a very similar interface here, the bar chart, a table that can be exported to a CSV file. Next, we have the uninsured population. And this is particularly interesting for COVID vaccination planning. Now, the Centers for Disease Control and Prevention has already released some initial guidance regarding targeted vaccination of specific groups. However, this guidance also indicates that the availability of vaccines is expected to grow after this first phase of vaccination has been completed. If you decide, based on federal guidance or policies coming down from the state, that you would like to prioritize populations, let's say by age, Replan will let you figure out how to place resources at your different pod locations to be able to make that happen. For instance, here we're looking at uninsured population only 65 and over. So once you've vaccinated them, you could potentially say, well, now I want to look at older adults. So I turn on maybe these two age ranges. And I could turn on maybe 19 through 44. So I look at younger adults. And of course, you can toggle each one of these on or off as you wish. When pediatric dosages become available, you could start looking at 5 and under, or depending on how these are labeled, basically up to 18. So the goal of this is to put as much of the data into the hands of the actual planners as possible, while making it easy to use this system effectively with a minimal amount of training and practically no GIS experience. Of course, all this data is also available here, where it can be exported to CSV file or viewed as a bar chart. Finally, let's take a look at transportation vulnerability analysis. So what I'm looking at here is data from the Census Bureau on households that do not have a private vehicle available. If you are basically tasked, or if you're basically told that you can receive a vaccination at a nearby pod site, but that pod site is too far away, you don't have a car, how are you going to get there to be able to get your vaccination? This is a problem. And we need to be able to understand what the populations look like in terms of vehicle availability and vehicle ownership. So this tool in Replan lets you explore just that. So here we can see where vehicle ownership is, which pod's vehicle ownership is much lower at. We can also explore how many of these households live specific distances away from their assigned pod location. For instance, it doesn't really matter if you don't have a vehicle available in your household. If you live right across the street from your pod, you can just walk there. So let's say that a person could walk up to a mile each direction to get their vaccination. Well, the total number of households that don't have access to a vehicle is almost 69,000. And almost 9,000 of those people live within a mile's walking distance of their pod. Which means that here we can see that about 9,000 of them, if 1 mile is an acceptable walking distance based on your expertise and your knowledge of your own jurisdiction, then we really only have about 60,000 left to worry about. Of course, this was just an example. I can put any number I'd like in here and it will calculate. So now if we say 2 miles, it drops down to just under 40,000. So now we've dropped about almost 30,000 people, around 29,000 people. Or, I'm sorry, 29,000 households. So this concludes the plan creation and plan analysis features of the Replan COVID-19 response tool. If you're interested in building custom regions to reconcile overlaps between misaligned but overlapping jurisdictions, I'm going to make a separate video that you can watch for. Thank you.